thank you so much. So we're going to be talking about the retail health arms race. And so that's going to be our topic for the day. And you might think, well, arms race, that sounds a little combative. And believe me, it is. It is a combative area. And it truly is an arms race, and truly one that a lot of money, a lot of investment, a lot of time is going into. And as soon as we get our presentation up, we are going to go right into it. For those of you, I'll skip the commercial part because that's going to be my second slide. But for those of you who are not aware of WD Partners, I'm the Executive Vice President with WD Partners. And we are a firm that works with many of the leading brands in the world, many retailers, food service brands, as well as I lead the health and wellness practice. And we develop and design world-class experiences with those brands and then help them to execute those in scale. And so that's a little bit about WD Partners. I actually came here in 2018 at not this location, but for HealthSpaces. And at that time, I warned the audience and talked about how retailers were primed to be a major player within healthcare. And that was unusual at that point because CVS had just purchased Aetna. It was really a first strike in this arms race. None of the rest had happened yet. And so I was questioned, to say the least, by many of the traditional healthcare people that were in the audience. But truly, that arms race is now here. It is clearly there, and you see that Forrester, for instance, is predicting that retail health clinics will double their share of primary care in 2023. And claims volumes in retail clinics are up 200% over the past 5 years. Bain is now predicting that retail disruptors could own as much as 30% of the primary care market by 2030. So this is a significant thing that is occurring in this marketplace, not one to ignore. So these are some of the disruptors, and that doesn't include everybody. There are a lot of retailers that are involved with various clinic strategies, various healthcare strategies, but these are the ones that are really leading the charge. CVS, Walgreens, Walmart, and Amazon, which now has One Medical, and Jamie's going to be talking extensively about that. But they're not just doing clinics. They're not just doing primary care. They're developing an entire ecosystem surrounding the consumer. They're getting into primary care, of course, but also virtual care, urgent care, and immediate care. They have pharmacy, and they own many, many pharmacy customers. They have behavioral health. They have clinical trial businesses and home health. They're building an entire ecosystem, not just clinics. And they have scale. That's what really sets them apart. When you look at the kind of dollar volume and revenue that they are doing, with $573 billion, $513, Walgreens being the smallest of them at $132 billion, compared to the largest health systems in this country, much greater. So you see the kind of clout and the kind of investment that they can make to scale these concepts, to scale the businesses, invest in them, and grow them. Certainly a force. But they have other key advantages besides that investment. They have access. You have 23,000 locations amongst those four players. And then you have brand recognition. Consumers know these brands. They trust these brands. They've been working with them for many, many years. They have foot traffic that's already there. The frequency, 167 million people go through Walmart every week. That is an immense amount of foot traffic, an immense amount of opportunity for them to register their opinions. And then exposure. Billboard effect of seeing their stores on every street corner, or the large environments that they have in places where you drive to. So there's an enormous billboard effect of that. But more importantly than almost anything else, they are consumer-centered. They thrive on demanding how to create experiences that really resonate with consumers. That's what they built their business on. And that is important to recognize. So let's take a look at each of these players and what they're doing, starting with CVS. CVS, of course, has minute clinics, and we've known about minute clinics for a long time. They have 1,100 minute clinics, and that's been a bread and butter business. But then in 2018, they added the Health Hub concept. We actually helped them to develop that concept. And that concept has been rolling out and is close to 1,000 locations now for health hubs across the country. But then they made a $25 million investment in Array Behavioral Health. So now they're in behavioral health as well. They have virtual care that they're offering through Aetna as well as through their CVS Caremark divisions. And then they bought for $8 billion, they bought Signify Health to bring home health management into your home. And along with that, they got 10,000 clinicians, by the way. 10,000 clinicians along with Signify Health to go into the home where they already had their infusion services going as well. So now they have home presence as part of their ecosystem. And now they're having a huge commitment to primary care, making a $100 million investment in Carbon Health, and then a $10 billion acquisition of Oak Street Health, which is a senior-focused Medicare Advantage primary care group that has 169 locations. And of course, they had Aetna. This makes them a vertically integrated network. It makes them somebody who can actually activate this entire network in a value-based way. And they are incentivized to do that because, of course, they're going to save money at Aetna through a value-based network. So certainly, CVS is in a prime position to have an outstanding ecosystem for the consumer in healthcare. Walgreens has taken a little bit of a different tact. Walgreens, of course, has virtual care as well through their MD Live. They bought also CareCentrix, which is going into the home, part of that ecosystem. Summit Health came along with their purchase of Village MD, Village Medical. And Village Medical, of course, was a huge acquisition that they made with 680 locations. And they are actively, aggressively rolling this concept out. And as side-by-side, some of them are co-located, some of them are independent, but they are doing a new location every 3 days of Village MD. And they're gonna have 1,000 locations by 2027. And then Walmart. Walmart, of course, has 4,700 stores. So not somebody that you can take lightly, and they are a behemoth in the retail business. And now they're getting into healthcare. They started out doing that in little pilot experiments in Texas and Oklahoma. Then they created Walmart Health in the Atlanta area. They now have almost 35 locations around the country, and they are going with a total healthcare approach, where they are looking to add primary care, dental care, hearing, x-ray and radiology, behavioral health, all in one location. And then, of course, they stand for value. So they're trying to really set across this value image with very inexpensive visits, as well as transparent pricing. So even if you don't have insurance, it's an inexpensive visit for the consumer to come in. So that's where they're really going to hang their hat and be strong. And then you have Amazon. And Amazon is one that a lot of people like to scoff at what Amazon's doing. They like to try and fail, and they do. They've abandoned certain initiatives, certainly. They are certainly making a mark in pharmacy. They bought PillPack in 2018, and now they've converted that into what they call Amazon Pharmacy, so you can have pharmaceutical products and medications delivered directly to your door. And then they created the RX Pass. The RX Pass, if you haven't heard of it already, is if you're a Prime member, you can spend $5 a month, and you could get an unlimited number of 60 different medications delivered to your door. And that is, so they all have to be generic. They all have to be off-label. So you now have the ability, if you're a chronic care consumer and you take lots of medications, $5 a month, you can have these medications delivered right to your door. And then, of course, they own Whole Foods. And then they also have Amazon Fresh. So they could actually activate food as medicine, with something that Walmart can do as well, which is something that's lacking in many health providers, is being able to link nutrition to your healthcare needs. Well, they have the opportunity to do it. Are they doing it yet? Not yet, but they certainly have that opportunity. They have Amazon Clinic, which is the virtual clinic operation for many of the leading conditions. It's kind of an 80-20 approach to look at how to create this virtual care for things that many people suffer from, but they don't necessarily need to be seen by a physical physician. And then, of course, One Medical. This was their $3.9 billion acquisition that they made, and it gives them access to hundreds of locations, 200 locations or plus, and gives them a physical presence. And that's what we're going to discuss now as Jamie and I chat a little bit about what this means to Amazon and what it means for One Medical. So begin, Jamie, some people, if you've been under a log or something like that, you might not know who One Medical is. So maybe just start a little bit with what is One Medical?
Sure. Well, I'm Jamie Goldberg. At One Medical, we also have this thing called CI Care Rounds. So we go into our locations once a month and we interact and see what's going on in the locations. And the I part is introduce. So I'm going to introduce myself. I'm Jamie Goldberg. I head up the real estate function for One Medical. And that means real estate, design, construction, and facilities. And a little bit about One Medical. We're primary care. So we have about 200 locations across the United States in about 28, soon to be 29 markets when we launch Milwaukee later this year. And we're an integrated hybrid in-person virtual care offering, which is a little bit different than some of the things you were discussing with Minute Clinic and some of the other things that our big health companies have invested in, because we're traditionally independent primary care. And we're looking at having that relationship with the consumer, the customer, for their primary care and managing their care in a one-on-one basis. So we're not trying to play in the urgent care business. We're not trying to play in some of the other acute care verticals of medical. So that's One Medical in a nutshell.
Very good. And what really, we just talked about a lot of different retail players. How does One Medical stand out versus what you just saw with regard to these other retail players?
Yeah, it's kind of our mission statement, which is transforming healthcare for all through a human-centered, technology-based care platform. So we're trying to take all those gaps in the healthcare system and integrate it into primary care. So a lot of the times when you go to urgent care, which is a very useful tool, but you're not getting the connected care for your chronic health conditions. You're not seeing the same consistent provider who's going to help you navigate through the healthcare system. So that's how One Medical is very different, is because we take the customer who becomes a member of One Medical, so we're a membership model, where if you go on your phone today and go to the Amazon app, you could click on the One Medical at the top and join One Medical.
And it's a discount now for a while,
well,
right?
Not right now, but
Oh, okay.
Who knows what will happen in the future. And then you become a member and we take your insurance, and we take your insurance like any other primary care provider. But the way it's different is we're just connecting that care. We're managing you through the process. If you need specialty care, we're coordinating that care. And if you have a virtual visit with one of our providers, that comes back to our ecosystem so we know what happened to you. So we're managing all of your care and it's all connected.
I think as a One Medical subscriber also, when I go in, it's very obvious that it's different too, because it's so beautiful. I mean, your offices are not clinical. They don't feel like a doctor's office. They feel like a residential setting almost.
Yeah, I mean, that's true. That's one of the other things. And you had two really interesting pictures of our Strawberry Village location in the Bay Area, and then Preston Center here in Dallas was the other picture you had up, which are two interesting designs. And that's kind of one of the things that we're looking to do, is kind of get rid of barriers to the healthcare system. We're not on medical campuses. We're not in big box retail. We're in these retail centers that have easy access for you to go into, find parking, good signage so you know where we are. And one of our value propositions is, as you may know, that our appointments start on time and end on time. So if you have an 11 a.m. appointment, you come into One Medical, your appointment starts at 11 a.m. And the provider comes, gets you from the lobby and brings you into their exam room. So they're not seeing 4 patients at a time, bopping in and out of your room for 8 minutes. You're not having your vitals taken by somebody else. You're having that relationship with the provider so that we can really be a part of your day and not ruin your day when you're trying to get your health care.
Absolutely. We talk about One Medical oftentimes as a disruptor. Do you see yourselves as disruptors? Does One Medical view that, and does Amazon view you as a disruptor?
I think so. I mean, I think one of the disruptors that we see is that, we partner across the country, and I know we might talk about that a little later, with different healthcare systems for continuity of care. So one of the way we break down barriers is we go into a market and we really try to hit the consumer where they work and where they live. So we're not confined to medical office campuses, MOBs or hospital campuses. We're really trying to locate where it's convenient. So we're breaking down that first barrier, that you go to a convenient place, you see where One Medical is located, you know how to get there, you know that you're not gonna have to go through, a big building, find the elevator bank that goes to the primary care provider. you're going to a retail type location, you're checking in and where they know who you are and they greet you and you have the lobby to wait in. And we build these big, beautiful lobbies, but people really aren't waiting in them there very long. Unless they're coming, like I always talk to people and say in New York, we're really known for our really fast Wi-Fi in our lobbies. So people are coming in like a half an hour before their appointment times and working in our lobbies. And they always, sometimes when people don't know who One Medical is, they ask us if we're a furniture store. And where did that couch come from? Or where did that lighting fixture come from? So we're disrupting it that way, but it's really the disruption is taking down the barriers for care. So you have this setting where you're not as scared or nervous to go in. It fits into your schedule. You're getting primary care with a physician who's going to take you through the system, who's going to manage your chronic conditions and help you be healthier. And I think that's what attracted Amazon to us as well, is that we have that care model and we're consumer focused.
And you have a physical presence, which all these others are really virtual presence. So that physical presence. What else do you think Amazon saw in One Medical that? And I know it just closed, so there's a lot that you're still going to figure out. But what else do you think that Amazon saw in One Medical?
I think it's because we're both like customer obsessed. We're trying to make that customer experience really valuable, that you have an experience that you like and you'll want to come back because you're getting that great experience. But it's also innovation. One Medical had been innovating, really taking down barriers, really trying to connect the gaps in healthcare from the virtual care that you get as a One Medical member, an all-you-can-eat virtual platform that's like virtual triage where you can call us at 2 o'clock in the morning and you see one of our providers on a video and say, yes, go to the emergency room, go to urgent care, or no, this is something I can call on a prescription or make an appointment for you to come the next day. So that connects what Amazon was missing in having the physical locations. But Amazon also has a goal similar to ours of transforming healthcare, is they want to bring healthcare to the masses. They want to make it more convenient. They want to break down those barriers because they see healthcare and being healthy is really important. And for their portfolio to be successful, they need people to be healthy and they need consumers. And so Amazon is also really always works backwards from the customer experience. And that's very similar to the One Medical philosophy. So joining those together, we get to bring the One Medical model with Amazon to more and more people across the country.
And after you've had a One Medical experience, we talked about the pharmacy offering that Amazon has. What's the natural progression after you go visit the doctor? You often have something that you need to have fulfilled, right? And then that gives them an entree into being able to fulfill that through their pharmacy.
Yeah, I mean, like you said, it's very early.
Yeah.
But I think there will be many innovations that come from Amazon purchasing One Medical in the future, that you'll see a lot of things that they do and a lot of things that One Medical really coming together.
Absolutely. We're seeing a lot of innovation, not only here, but there's a lot of innovation in the health and wellness market in general. What types of health and wellness services do you think are the most popular with consumers right now from your vantage point?
That's a tough one. There's a lot of things. You've seen from the different slides you had on there about what Walgreens is doing, what Walmart's doing, what CVS is doing. It's really access. Yeah. And so we're partnered with a lot of the health systems, and some of our health system partners are here in the room. And one of the things we hear from our health system partners is they don't have access to primary care, that it might be 30, 45 days to get an appointment for a physician who's trying to build their panel of primary care. So it's the access. So what really is resonating with consumers is the access to primary care. And kind of that hybrid model of the virtual care and the in-person care coming together so that you have choices. So I think that's resonating. And the ability to manage your chronic conditions is really important, to be able to see a provider, when you need to see that provider to manage those conditions. And it's also, sexual health, managing those issues that come up, that really seems to resonate, that we have a lot of our folks coming in for that, really for mental health issues as well. During the pandemic and post-pandemic, mental health issues have really come to the forefront. We heard that in earlier sessions here about behavioral health and how you connect behavioral health to inpatient, to where somebody goes after they're released from inpatient. And One Medical really has a platform to try to bridge a lot of those gaps.
Absolutely. You mentioned your background in real estate and your role in real estate, and and it seems like health and wellness is kind of a hot model for landlords when we look at the retail market. Why is that, and what do they see in something like a One Medical?
I mean, there's other, One Medical is part of it, and there's, Carbon Health, there's Tia, who's, not growing as much, and there's Kind Body, and there's regional players. And I think all of us as a group have done a good job of like translating what care can be in a retail setting. So I think that's part of it. And landlords are seeing that centers are a lot different than they used to be. They need to create an experience for people to get off of their computers and actually go to a retail center where we like them to order from Amazon, especially now that I like them to order from Amazon. But really, to get to that retail setting, you have to have an experience. You have to have interesting brands. You have to have the entertainment component, the interesting soft goods component, and then I think you connect it with medical. So you have the ability to draw customers into your shopping center to have all those services. And then landlords have kind of evolved too. They used to think medical and retail was that horrible elbow space in the center that nobody else wanted. Or they had that second floor, for some reason, office component to a retail center, and that's where medical was supposed to go. But we've had to say, no, medical is important, that access, the parking, the ability, and especially for One Medical, with our appointments starting and ending on time, we need it to be accessible. So we can't be buried in the center. We have to be convenient. So all of that with Walgreens and everything, having that signage, I think landlords are used to seeing medical in that setting.
Well, and in fact, we both have gone to ICSC, International Council of Shopping Centers, and they have a term for it. They call it medtail. When you go to the real estate conferences, they call it medtail, and it's not just with what we consider as healthcare providers. We think of it as treating people with medical conditions, but they view it much more broadly. Other services, salon services, chiropractic services, other kinds of services that you would often find in a retail setting, but bringing those all into a center.
And I think the medtail is interesting. There was a New York Times article, I think, that coined it. And I got asked a couple questions about it, and it's kind of an interesting how it's evolved as a term, but it is true, and it's also kind of boutique gyms that are kind of lumped into that category, the Barry's Boot Camps, the Orange Theories, those type of players. And centers are creating this medtail type offering where you can go to these different type of services, and centers are seeing that that's drawing in traffic. So it becomes something that is an asset class now that landlords finally are accepting and seeking in their centers, where in the past we were dismissed.
And I think it gives you an opportunity, as you scale, to be able to identify these types of locations and do it easier than just greenfield types of locations as well.
Absolutely.
What are some of the challenges that are associated with that model, though, that retail tenant model?
Landlords still have some old ideas about, antiquated ideas about where One Medical or any retail service should go in their center. So it's really being able to stay true to our criteria of really wanting those prime spots and really explaining to the landlord about the access, about the parking, about the signage. But then, medical tenants have to be very, do a lot of research and know who's going near them. You don't want a gym next to you. You want a gym near you, but you don't want it next to you because you hear that loud noise. And that sound attenuation works, but it's not great if you're listening to heartbeats or if you have to have conversations with your patients. Like there was an example, one time we were looking at a spot in Brooklyn and we're underpenetrated and we have lots of demand and it's a very tough market to find first floor retail. We had a space that was great and there was a children's play gym above us and all the footsteps and all the pounding really impacted what we thought the experience for our member could be. And so we looked at different sound attenuation and we just couldn't get there, so we had to pass on the space. So that's a big challenge, is who's next to you, who's near you, how you fit in the different players, and where you go in the center, really does make a difference.
Absolutely. What are some other innovative or interesting ways that you see incorporating more health and wellness types of offerings into the retail offering?
I think it's technology-based too. We've talked a lot at the sessions about technology and how that's transforming a lot of parts of the health and wellness space, and it really, resonates in what we're doing and what, Walgreens and what CVS does with their app, so you can see your refills and when you should be going in there to pick up your thing, when Amazon's pharmacy is delivering you, you get the notice when your prescription is going to be delivered, so you know you're not going to run out of medication. It's all that technology. One Medical is very technology forward. It's part of our mission statement. You've seen it in your app. You can book your appointment. You can check on your tests. You can find your medical records. You could ask for virtual care. You could communicate with your provider through the app, and they actually communicate back with you. So it's that technology, and then mirroring that with the location really helps, having that physical presence. But the technology is important. And I think all of us will say that technology really helps and integrates our physical space because people can use us in a different manner, in a more convenient way, and really get the services they need, and the technology is important for that.
Where do you think all this goes, this retailization and all of these retailers? As you look at the future, where do you see the retailization of healthcare going?
Yeah, I wish I had that crystal ball for a lot of things, right?
Yeah.
Especially return to work. I know we've talked a lot about that today too, because a lot of our locations in big major metros are kind of in the urban core. So that's where One Medical started, and so getting back to work and understanding how that goes has been important. But I'll take just one step back before I get to that question. But we've seen in the urban core that people still have that relationship with the primary care provider. So they're coming back for their appointments. So they're going into an office workday and seeing their primary care provider when they're in the office. So our urban locations have not struggled as much as we thought they would have during the pandemic and during when people were not back to work and more in this hybrid model. But how that translates into retail is just, what does the center look like in the future? We've all seen soft goods stores really shrink in size, that a lot of them have that omni-channel. And you've been in the retail world for a while, and we've been hearing omni-channel for 15, 20 years, and it never really happened, but it's happening now.
Oh, it is.
And so, soft good locations are shrinking, and landlords and developers are looking to bring, like I don't want to repeat myself, but that experience back to the center, where you have to have that experience to make people come to your center, and having healthcare a part of that helps. So I see the future is that healthcare will be very important, and it will be a service that all landlords want in their centers.
And I would add, from my perspective, I think that we're going to see more pieces of healthcare also become more retailized. I think specialty care in many cases, women's health, orthopedics. I think other things are really going to become, there are going to be retail concepts that really strongly relate to those as well. Whereas primary care and urgent care, are well established on that road, I think specialty care is going to be a next forefront.
Yeah, I think that's interesting. I don't disagree with it. I think they have a little bit more challenges in primary care, and to some extent urgent care, because they might need different types of equipment and different electrical needs and different power needs than primary care. But it is the next evolution. Especially as you've seen the success in the retailization, the medtail, it's just going to draw more people into that space to say, hey, this is where I can really draw in patients to come and be convenient and have them utilize us and really do their follow-up care. And that's the one thing about the retail locations we're getting, is we're really seeing follow-up care, which is important. Just going to the provider once, getting a chronic condition diagnosed and not coming back for follow-up care doesn't really help you be healthier. And One Medical, with the Amazon model of the consumer focus, really connects that, so you do get that follow-up care.
And you mentioned partnerships that you set up with health systems. Tell us a little bit about what role does that play? Why do that? What does it do for you? What does it do for the consumer?
Sure, and the health system too. So yeah, we're partnering with about 15 health systems across the United States now in different markets. So we're independent primary care. So when we go into a market, we really need a partner for that care model, that care journey, so that if you need specialty care, we have a partner to send you to. And health systems like us because we're primary care, and we are going to be a good source of the front door for that system. We've heard about the capital challenges in some of the healthcare systems and big hospital systems today, and we know it takes a long time in a hospital system to make a decision on a capital expenditure. Well, we could make that decision faster and be more nimble and get locations open quicker and then be that front door for that healthcare system. So that's where it benefits them, and it benefits us by having that continuity of care. Without that, we're not going to be successful in a market. If we don't have a partner to refer in to see the whole history of the patient, it's not going to resonate with the consumer, our consumer and our members in the market. And it also gives us more brand awareness. We're just One Medical. In Dallas, we're partnered with Baylor Scott White. Having Baylor Scott White as a partner, a trusted referral partner in the network, gives us the ability to have that confidence in a new market when we come into Dallas that we are in with a trusted brand in the marketplace. And it really provides that whole closure of the loop.
We've got about a minute left. Do you want to take a couple of questions,
Sure.
maybe? All right. If anybody has a burning question here for the next 60 seconds.
I mean, so it's really kind of.
The question was on decarbonization, if you didn't hear.
So it's just kind of, build techniques, looking at LEED standards and trying to build to LEED standards. My team has had a long experience in LEED builds and LEED certifications, so we integrate that into our builds. Being a smaller footprint, we have a little bit less impact from the overall landlord building, and just kind of the materials we use in the locations, how they're cleanable, how we go about that with different things, and recycle programs, and the partners we have.
That's time. Thank
All
you
right.
so much, gentlemen, for this. Dan is also an excellent podcaster, by the way. They have a podcast through WD Partners, and he interviews all kinds of bigwigs, and it's well worth listening to.